Hello, everyone. This is Mark Anthony with AIEdgePodcast.com, the place where we bring you the best of the best doctors in their niche and in their area. I have a special guest today. And yes, I know I say the word special all the time. And the reason why, because each person is special with what they do and in their area. Today, we're hearing from Dr. John Maher, valleycenterchiropractic.com. That's right. Get your pencils out. Let's go old school here. Get your pencils out, get your computers out, go to valleycenterchiropractic.com. Now, why would I say that? Well, let's talk a little bit about Dr. John Maher. And before we do, we're going to look at a few things. What has Dr. John Mayer accomplished? And that's very important. And I'll tell you what, I've met up with a lot of doctors. And the interesting thing is, I've noticed that a lot of these people that are chiropractors, I don't see a whole bunch of bragging rights. And maybe some of them do. But with this one, I love this one. He's mentioned as best chiropractor in the Valley, in the Valley Center. He has received this local distinction multiple times, guys. And not only that, but also including the recent award for 2023, 24, and 25. We're going for 26 here. Come on. He's also nationally recognized. He was named one of the top 25 chiropractor clinics in the US of A, guys. Come on. By GHP Magazine in 2017. Also, we're not done yet. Wait, there's more. I'm like an infomercial here. Let's have some fun here. International Association of Chiropractors, the IAC, selected as a top chiropractor in Valley Center by the IAC, which recognizes healthcare. This is huge, guys. Which recognizes healthcare professionals who demonstrate leadership and success in their field. So if you guys are looking for someone that knows what they're talking about, that understands the vertebrae, that understands subluxation, and that understands the human body to get it to move and function the way it is, look no further. We have Dr. John Mayer. And today we're going to be talking about what is nutritional response muscle testing, NRT. What is that? Nutritional response muscle testing. Thank you so much, Dr. John, for being here. How are you, my friend?
I'm most wonderful, thank you, and blessed.
You are a blessed man. I mean, come on. I love the fact, and when I say blessed, of the people and how many people you're helping, and just you're a blessing to with what you do in your field and in your area. And I'd love to start this off before we go into what is nutritional response. Talk to us about how you got into chiropractic.
Well, I had my best friend. He had his child and his wife both had asthma, and he brought them to a, a famous doctor in the chiropractic field, Dr. Scott Walker in Encinitas, California, and he got them both well with from their asthma. And he actually practiced techniques similar to what we're going to talk about today, nutritional response testing. And so Dennis decided to go to chiropractic college. And I was working and living up by Riverside area. And when I heard what Dennis was doing, I began to help him study. And I loved it so much because I was the one who, from the beginning, was into yoga and natural health. I decided to take a demotion in my job, work at nights, and then go to school in the day. And I became a chiropractor and have been enjoying it ever since.
That's awesome. And audience, I'm talking to you guys out there. I want you to catch something. This is really rare. There's so many people that get into professions because of the money or because of that. And I love the fact that you got into this profession because of the focus on helping people. And before we even start and open up this beautiful Pandora's box, tell us a little bit about your practice and what you offer.
Well, I like to call my practice a one-stop health shop. So I do all kinds of chiropractic techniques, both a non-force and traditional. I also include things like laser acupuncture. I also do a lot of nutritional work, doing homeopathy, nutraceuticals, bioidentical hormones. I even do emotional things like emotional freedom technique. So I have a very, very big toolbox, and the name of my practice is Valley Center Chiropractic and Holistic Care. And I use a chiropractic technique called applied kinesiology, which most people call muscle testing, in all of these things where we access the body's own information and responses to figure out what's the best thing to do for each patient, especially when I have such a big toolkit.
Wow, that's awesome. So let's talk about this topic here. What is nutritional response muscle testing? I've never really heard of it said that way. How can you break that down to us and what that means and why it's so important?
Well, it's extremely exciting and extremely important. And one day, when it's accepted, which it will revolutionize medicine. But to put it simply, there is a phenomena where we can test a person's muscles very simply and then expose them, place on their body or close to their energy field. And if a product is the right thing, their muscle will strengthen. But if it's the wrong thing, their muscle will weaken.
I've heard of that.
Yes, and most
Yes.
people call it muscle testing. But the
Yes.
truth is, what we're testing is the nervous system. And chiropractic, of course, is all about the nervous system. And the muscles just do what the nerves say. What we're seeing here is really we're testing the nervous system. And when I say the nervous system, I mean both consciously and unconsciously. The nervous system is aware of things that you in your conscious mind are not. I know this is a hard concept. It's hard for my patients too. And so I demonstrate it to them in the following way. So I'll just have them lie down on my chiropractic table and lift their arms straight up as if pointing to the sky. Okay. And I will gently test a muscle. It's not a strength contest. It's just a simple response. Either the muscle will lock in and easily lock, or it'll wave around and be funny. And it's like they'll go, oh, and it's funny, why can't I control it? And then I'll take my vibrator and hold it about 3 feet from them and test them again, and they'll still be strong. But then I'll take the vibrator and put it about a foot away from their head, and they'll weaken and they'll be surprised. So I asked them, why do you think you weaken? And the common response is, I don't know. But another common response, a smart one, I might say, oh, it's the sound. Getting close to the ear, my body doesn't like that.
Huh.
So then I'll take my foot and put it on a grounding or an earthing pad. It's a pad that's connected to on your outlets, you have 3 holes, and the one on the
Yeah.
bottom, it's a ground. When I put my foot on the grounding pad and I'm holding the patient, and then I take that same vibrator and put it by a foot by the ear, they will not weaken, even though they hear the same sound. So that proves that it's not the sound. Do you follow me so far?
Yeah.
Okay, so if it's not the sound, why do they weaken? Well, the answer is the electromagnetic fields. The way I know it's that is because if I step on the pad and I'm in contact with the patient is grounded. And if they're grounded, electromagnetic fields will not weaken them. So the question, do you follow me still?
I'm following you.
Okay. So then I asked the patient, well, then how does your body know there's an electromagnetic field there? Can you see it? No. Can you smell it? No. Can you taste it? No. Can you hear it? No. So then I say to them, so do you realize your body has extra sensory perception? Now, when you say ESP, people tend to go to woo-woo land. That's not what I'm saying. I'm saying that your nervous system can sense things that your special senses cannot. It's an unconscious awareness. and that your nervous system has an unconscious awareness of frequencies that are brought within the body's frequency area.
Hmm.
Do you still follow?
Yeah, this is okay.
Oh,
I like this. This is I've been through this, by the way. So now this is why I'm intrigued and I understand where you're going with this. But a lot of people out there don't.
yes. So the other thing to understand in that everything in the universe has a frequency and vibration, just like the electromagnetic field does. We now know that everything has a different frequency and vibration. Red appears as red and green appears as green because it's a different frequency vibration.
Mm,
You burn zinc, you get one color. You burn copper, you get another color because they have a different frequency and vibration. And so does any supplement or homeopathic remedy. It has a different frequency and vibration. And so, what the nervous system is able to do unconsciously is to recognize any different supplement that you place upon it. And with its own intelligence, knows by reading that frequency, is it the right frequency to help heal the spot?
makes sense.
And
So give us an
and that's what
example. Give us an example of
okay,
someone that you've
exact
helped with and how you did it.
sure. Now I'm gonna have to explain a little bit of physiology, but it's not terribly important that you understand it. It's more important that you see that there's a process here that we're going through that is so very helpful. So let's take the example of osteoporosis.
Okay.
A patient comes in, they have a DEXA, they have osteopenia, osteoporosis.
Mhm.
That's fine. The question is, now what do you do? Now, of course, there's the basics. You exercise, and get sunshine and try to eat well, of course. But generally, what's recommended by most medical doctors is the same thing that's been recommended since the 1970s: a
Hmm.
cheap form of calcium, calcium carbonate, and a low dose of vitamin D. And although that will be helpful for some people, bone physiology is much more complicated than that. Bone has magnesium, it has phosphorus, it has manganese, but that's just the minerals. What what bone is made out of is collagen. I don't know if you've ever done this experiment, but back when I was young, you would take a chicken bone, put it inside vinegar, and when you let it sit for a while, when you take it out, you could bend the chicken bone like it was rubber.
I do remember that.
Yeah, and that's because the vinegar takes all the minerals out.
Hmm.
Okay. And so bone is mostly collagen, and osteoporosis is mostly bone thinning, having less collagen, so it can't hold the minerals. So the bone becomes weaker and weaker. Giving minerals is good, but maybe giving collagen is good. But if you want to strengthen collagen, do you give collagen, which is basically gelatin? Or do you give bone broth? Or do you give raw bone? Standard Process makes a product called calcifood, which is actually raw bone marrow and all, which is put together at cold pressed temperatures. So, which one of those do you choose? There's no blood test for that. No doctors are testing manganese. You can't test magnesium accurately in the blood. And how would you know whether to do collagen or bone broth or calcifood? So what I simply do is then expose people to various forms of calcium, because calcium carbonate is the cheapest form, and it's actually an acid, and you need acid to digest calcium. And most old people don't have strong stomachs. So if they need calcium, like calcium hydroxyapatite, which is a little bit of the calcium and a little bit of that bone protein structure we talked about. And then I would test them for magnesium or manganese. I could test them for with collagen or bone broth. And then there's the other question: how about the hormones? Does the person need more estrogen? Is estrogen safe for them? Or they need more progesterone? And is progesterone safe for them? And if we want to build progesterone, Do we give wild yam, which is a precursor to progesterone, or we give pregnenolone? I'm going to get a little bit deep in the weeds. You don't have to understand, but I want you to see how complicated it is. If a person,
Before you do it, I hate to interrupt, but before you do your best, just pretending as if nobody understands what you're talking about. I want you to do it as if you're talking to me as a third grader. Try that.
yes, okay, good. So when your body becomes stressed, it makes a stress hormone.
Mm,
And sometimes it'll make so much stress hormone that it can't make the other good hormones your body needs, including to build bones. And so sometimes the best thing is to lower the stress hormone so the body has enough left over to build up the bone building hormones.
love it. Beautiful. So how do you do that?
Well, then that's exactly what I would do. I would just test the person first with progesterone. Let's see they strengthen. Well, that's fine, but I don't like to use hormones unless I have to. Okay. So then I would look further and see why, in this case, why isn't the person making enough progesterone? Maybe it's because they have too much stress and they're making this stress hormone called cortisol and it's not able to make another hormone called pregnenolone. And pregnenolone is what the body makes progesterone out of. It actually has a name called the cortisol steal syndrome, where all your hormone making material goes to make stress hormone, not pregnenolone
Mm,
and not progesterone. So sometimes the best thing to do is to lower the person's stress. And that could be done by giving them other supplements like L-theanine or magnesium or ginseng.
all
So it's
natural
very,
stuff.
yeah. So there's all stuff. So how does a doctor figure out all these things? And the beauty is, I don't need to know the answers.
Mm,
I just need to know how to ask the question. And the question, the way we ask the question is to place a product on the body and we'll get yes, strong, or no, weak. And so I build in my mind a software program. If yes, go here. If no, go there. Right. And so I keep asking questions, getting yes and no from the body until I come up with the best answer. So this is the revolution is a doctor doesn't have to know all the answers. The best doctor has to know how to ask the best questions for which, and the body only gives two responses yes, no.
what does this tool look like?
I say that again.
What does the tool look like? You said it's like a vibrator?
No, there's no tool whatsoever. The only tool is the intelligence of your own body. I only use that vibrator explanation to show people that they're aware of electromagnetic fields, although they have no way of knowing of how they're aware of it. And so I'm teaching them that the body is aware of vibrations that come close to it. And since everything has a vibration, the body has an awareness of anything that comes close to it, if it's good or it's bad. So I could also demonstrate it to a patient this way, have them lie down, test a strong muscle, and put rat poison on. And when I do, their body will weaken. Well, how their body know that that was rat poison? So that's all I do. The patient just lies down, arms straight up in the air. I put the supplement on them and then test to see if the muscle is weak or strong. Now, before I, there's another part to this, and that also you can test all the reflexes in the body. So people are aware that there's acupuncture points. And you can test all the acupuncture points the same way. You can touch an acupuncture point, and if it's a good point to treat, the body will strengthen. And if it's not, it will not. Well, there are and these are called reflex points. And there are reflex points for the thyroid and the pancreas and the bladder, etc. So when we do nutritional response testing, first we test all the reflex points. And so if the reflex point is weak over the ovaries, then we're going to be looking at supplements that help strengthen the ovaries, as in the case of, let's say, PMS, which is premenstrual syndrome, which is a common thing I treat in the practice.
I went to this doctor years ago and he was trying to figure out why I was getting so many migraines. I had migraines for about 35 years, really bad. I even knew when I was going to get them really bad to the point where I couldn't work for like 2 or 3 days. And what he did was he was testing my body with muscle testing in a way, but a different way. He would ask me certain things while I had my hand out, and he would ask me like what I was using, things like in the shower, things that I was, eating. And when he mentioned certain things, he said that my body would weaken. I don't know if it has anything to do with that.
Uh,
But he did some type of Chinese medicine also where he gave like little pills that were natural. I'm not saying it's the exact same thing, but I noticed that he would say that whenever he would mention certain things, if I was doing that, my body would actually weaken. And I didn't realize that. Have you heard of that?
oh, I do that all the time. It's exactly
Okay.
what I do. I do that. I'll do that in, let's say, I'm doing emotional freedom technique on a person. And I might ask them this question, make this statement: I love myself. And if they do, they'll strengthen. But if they don't, they'll weaken. I do that all the time.
Powerful.
Yeah, it'll work with thoughts. I did a demonstration in grade school. I had a child placed on a chair, did a muscle test, asked the child then to go outside the room with another friend or two. Then I told all the students, now when he comes in this next time, I want you to think all bad thoughts about it. I want you to really think bad thoughts, everything you don't like, even make stuff up, just the worst possible things. I had him come back in the room and I asked him to be strong, and he couldn't be strong. I had him leave the room and then had all the students say, now I want you to say all the wonderful things and give him all the love you can possibly give him, all the blessing, and have him come in the room. And I couldn't in any way weaken him. I could touch all the different reflexes on his body. I couldn't weaken him at all. You see,
That says a lot. That says
that could change the world.
that it's interesting you say that. So, we've all gone through something in our life. We all have a story, as my mother always says. Everyone has a book over their head. And it's interesting because I've been through some heavy, heavy, heavy traumatic stuff probably in the past 24 months. Life events. It happens. I'm not looking for no tears. And what I noticed is that whenever I started to feel like sad or depressed, I started to say it out loud what I was thankful for. And I started saying, I'm thankful for my children. I'm thankful for their health. I'm thankful that just started all the little things that I'm thankful for. And what's so weird is that everything changed mentally. So whenever I start to even go close to that little funk fence, that's what I call it. I start thanking God for what I'm thankful for. And I start to realize that it's the little things that are the big things. And when you do that, your mindset changes, your body movement changes, your strength, kind of like what you're saying. I don't know if that's kind of in the same.
That's exactly what I'm saying. And I use all kinds of tools. I'll refer people to different kind of programs, listening to different frequencies with different affirmations, etc. Because of the technology today, you can get those on YouTube. And I can simply test which is the best frequency. Do I want to put them in a theta state with 4 hertz, or an alpha state, 10 hertz, or a gamma state with 40 hertz? All that becomes available. How would I possibly know all these things? I couldn't. But the point is, your body knows. I'll give you another idea. You can take a bunch of CDs. Let's say you're looking for the best CD for positive thinking for you. And there's 7 of them. I can place the CD on you and you'll strengthen to the best one because the CD has grooved on it. And what are those grooves? They're light grooves. And what are those? Those are just frequency vibrations. You can even do it with a books. Which is the best book for you to read? You'll weaken or strengthen to the best books. I know this seems incredible.
It's so true though. So like my book is the Bible. Like I love to study in the Hebrew and the Greek. And there's something about when you slow it down and you meditate on that, it does something. It's like
Amen.
life, it's water. It's like Psalm 1 when it says, you're planted as a tree in the water, and that water is the word
By the river
washing.
of life.
100%. Yeah, I love it. I love where you're going. So how do you when you help these people, how do you get them to stay in that state?
Well, some I do and some I don't because there's so much anxiety today. Life is so fast paced. And our culture, I mean, God bless America, but our idea of relaxation is packing all the kids and
And
renting an
this
RV, trapping all the kids who are back there reading their things. And, we just don't have a lot of R&R. So some I can help a lot. And some, frankly, their life situation is overwhelming for them. I only wish that I could work in a larger community of healers with special gifts, and someday those will be available. But it's just me there alone doing my chiropractic practice. So I do the best I can do. Sometimes there's miracles. Sometimes we just help them get along. And sometimes what's going on in their life is too much for that. But nonetheless, I'm still able to make a big difference at a very low technology. I'm not doing x-rays and MRIs and blood tests. I'm not against those things, but those are way overdone. And even when you get them, so now what? What's the best choice? And the more that you know, the more choices there are to consider.
wow,
Here's the thing
that's
I
amazing.
like the more rational minded of these listeners to listen to. What is the definition of a scientific phenomenon? A scientific phenomena is one that is observable, measurable, repeatable, and predictable, not understandable. I like to compare that to gravity. If you take an apple and hold it in your upper hand and drop it, it'll drop into the lower hand. Okay, that's observable. That's measurable. It will fall at 32 feet per second squared. Okay, we know that. Number three, it's predictable. Okay, when I drop this apple, it's going to drop down. So it's observable, it's measurable, it's repeatable and predictable. So I know when I drop the apple a second time, it's going to drop down. Okay. But the question is, what is gravity? Is it a particle or a wave? And the answer is we don't know yet, but we know there's gravity. Why do we know? Because it's observable, measurable, repeatable, and predictable. And I can do the same thing with muscle testing or nutritional muscle testing. I can demonstrate to anyone who's open to it the phenomena that it will be measurable. The muscle will be weak when I touch a certain point, put a supplement on them, it will strengthen. That's measurable. They can see they can observe it. It's predictable because I'll tell them that it'll strengthen when I put this one on them, but it will not when I put that one on them. And it's repeatable. We can do it again and again and again. So it is a very scientific phenomenon. Exactly how it works yet, we don't know. But we do know that the body has awareness of things within its vibrational field that the special senses are not involved.
I like that. So what you're saying is everything you're doing is measurable.
Oh, this is clearly measurable. And the measure is simple. The muscle be strong or weak. and the person can observe it because they're the the patient.
So it
Okay.
turns on.
Yeah,
Oh,
so it's
that makes
observable.
sense.
Yes, and then it's repeatable. We can repeat it again and again, and I can make predictions. In other words, I'll predict that this supplement will strengthen you again. And I can actually do that with anyone who's willing to sit down and do the test. And I often do it with my patients who are more left brain and they like that explanation. People who are more right brain, they just love the phenomena. This is the thing that they love. And of course, those tend to be my best patients because they don't you know.
Man, wow, I love it. So if there's one thing that you would basically tell to your audience, because this will also, of course, start to reach people in your area when they look for you online, what type of advice would you give to them right now if they're kind of on the fence and they're not sure? But I think it would be great for them to see it.
Well, the simplest thing, frankly, is to gamble with $125 and come in and let me examine you. And then observe it for yourself. I'll do the very same test with the vibrator that I talked about earlier, and I'll demonstrate to them that muscle testing works. So do this and say, now watch, observe your muscle, see what give it strong or weak, see what happens when I put a supplement on you, see if we can't repeat it over and over again. And I will tell you before I do the test whether you're strengthened or not. And I demonstrate it to them. And once they see that, they go, hmm. And of course, I would ask them to go online and read the testimonials, of which I have a plethora from all kinds of disorders. So to give them a bit confidence, go ahead and gamble this $125.
I love it. Okay, so do you have any have you ever recorded what you're doing? Like you do it kind of like live and asking questions or anything like that? Or have you thought about doing that or have you already done that?
Well, I've taught doctors around the world, well, I shouldn't have- around the world, around Canada and United States, how to do this kind of muscle testing. I am considering writing it all down, but I haven't done any videos, et cetera, of it. I would love to do that. My interest would be more in teaching doctors how to do these things.
I love it. How to get that out. And how many years have you been doing this? Just that technique itself.
Well, I've been doing muscle testing as such since the very beginning and using supplements, using muscle testing from the very beginning, way back in 1980. However, the refinement of the technique just evolves and evolves and evolves like anything else, whether you're learning guitar or painting or anything else with years and years, it's that old 10,000 repetitions thing. And the beauty of the muscle testing, I constantly get a yes or no answer. So if I go and explore, let's see how this works. I get a feedback system from, yeah, so I would love to do something like that.
Okay. Yeah, because I think that would be really cool if just just saw at hand just live. And I think that if people kind of knew the reason behind it, why that's important,
Well, it
that
might be interesting also just to demonstrate this for lay people, just to have somebody see it happen. Yeah, just have somebody see it happen. And we can actually demonstrate even with the vibrator and then the supplements, et cetera. So they'd have a visual because this was a lot of words. And the truth is this is lent itself greatly to visual experience. The best experience is what happens to you, but the
right.
next best experience is to at least visually see it happen with somebody else as compared to all these trying to explain it in this method.
Wow. Wow, that's awesome. I just want to say thank you so much for being here, on the show. As you know, everyone, this is Dr. John Mayer at valleycenterchiropractic.com. Did you also say you had another one, Valley Center Chiropractic Kinesiology.com? Is that correct?
No, it's Valley Center Chiropractic and Holistic Care is the name of the
Okay.
practice, but I have two URLs. valleycenterchiropractic.com and valleycenterholistic.com.
And also thank you for talking on the nutritional response and the muscle testing and explaining that and breaking it down for us layman's people.
Yes, it's my pleasure. And I use that same muscle testing through all my chiropractic work as well. So that's why I call it chiropractic and holistic care. It is kind of a one stop health shop for people who want to get well naturally.
Okay, I love it. And thank you so much for being here on the show. And I look forward to you for let's get that 2026 Best Chiropractic in the Valley Center Award.
All righty.
All right.
Thank you
Thank you
so
so
much.
much. Oh yeah, I appreciate you and love what you do. And I look forward to seeing the future of this because I actually see this growing. And I think a lot more people are starting to catch on to what you're actually teaching on. And I'm glad that you're able to break it down to third grader terms for us
Amen.
layman's people. All right. You have a blessed day.
God bless.